Pelvic floor muscle strength becomes increasingly important for men after age 50 for bladder control, prostate support, and overall pelvic health. Today we're covering pelvic floor exercises, commonly called Kegel exercises, specifically designed for men. These exercises strengthen muscles supporting bladder function, urinary control, and pelvic organ support. When practiced correctly and consistently, they can help improve urinary symptoms and pelvic floor function. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting pelvic floor exercises, especially if you have prostate problems, recent surgery, urinary tract infections, or pelvic pain conditions. Understanding male pelvic floor anatomy and function. The male pelvic floor consists of layers of muscles and connective tissue forming supportive structure at base of pelvis. These muscles support bladder and bowel control, maintain urinary continence, support prostate gland, and contribute to sexual function. After 50, pelvic floor muscles can weaken due to aging-related muscle loss, prostate enlargement or surgery, chronic constipation or straining, prolonged sitting, and reduced physical activity. Weak pelvic floor muscles may contribute to urinary incontinence or leakage, urinary urgency or frequency, post-void dribbling, and reduced sexual function. However, research shows that appropriate pelvic floor muscle training can significantly improve these symptoms for many men. Identifying pelvic floor muscles correctly before beginning exercises. Correctly identifying pelvic floor muscles is essential. Here's how to locate them properly. While urinating, try briefly stopping urine flow midstream. The muscles you engage are pelvic floor muscles. This is only for identification purposes, not regular practice. Stopping urination regularly can cause incomplete bladder emptying and urinary tract problems. Alternative identification method: imagine preventing passage of gas. The muscles you tighten are pelvic floor muscles. Or imagine trying to lift testicles without moving legs or buttocks. When correctly engaging pelvic floor, you should feel gentle inward and upward lift deep in pelvis, without tightening buttocks, thighs, or abdominal muscles excessively. If you cannot identify these muscles, consult physical therapists specializing in pelvic floor therapy for guidance. Basic Kegel exercise technique. Once you've identified pelvic floor muscles, here's proper basic Kegel technique. Find comfortable position, sitting, standing, or lying down. Relax body, particularly abdomen, buttocks, and thighs. Take normal breath in. As you exhale, gently contract pelvic floor muscles as if stopping urination or preventing gas. Contract should feel like gentle lift and squeeze inward and upward. Hold contraction for 3 to 5 seconds while breathing normally. Don't hold breath during contraction. Relax muscles completely for 3 to 5 seconds. That completes 1 repetition. Start with 8 to 10 repetitions. Complete 2 to 3 sets daily. Rest between sets. Important reminders: isolate pelvic floor muscles, avoid tightening buttocks, thighs, or abdominals excessively. Breathe naturally throughout, never hold breath. Contract muscles gently, excessive force isn't necessary or beneficial. Focus on quality over quantity of contractions. Integrating breathing with pelvic floor exercises. Proper breathing enhances pelvic floor exercise effectiveness. The diaphragm and pelvic floor work together as coordinated system. Here's proper breathing integration. Sit or lie comfortably with relaxed posture. Inhale slowly through nose, allowing belly to expand naturally. As you exhale slowly through mouth, engage pelvic floor muscles with gentle lift. Continue breathing naturally while holding contraction 3 to 5 seconds. Release contraction as you inhale again. Rest for several breaths before next repetition. This breathing coordination supports proper pelvic floor engagement, reduces tendency to hold breath or create excessive tension, and promotes relaxation between contractions. Natural breathing is essential for safe, effective pelvic floor training. Posture considerations for pelvic floor exercises. Posture affects pelvic floor muscle engagement and exercise effectiveness. Good posture supports optimal pelvic floor function by maintaining proper pelvic alignment, reducing excessive pressure on pelvic organs, and allowing diaphragm and pelvic floor to work efficiently together. Proper posture for pelvic floor exercises: sit on edge of chair with feet flat on floor, or stand with feet hip-width apart and weight evenly distributed, or lie on back with knees bent and feet flat. Maintain neutral spine with natural curves, avoid excessive arching or flattening. Keep shoulders relaxed and down, chest open. Imagine lengthening through top of head. Avoid slouching or excessive forward lean which compresses pelvis. Good posture creates optimal conditions for pelvic floor muscle engagement and training. Building exercise routine and progression: start conservatively and progress gradually. Week 1 to 2, perform 8 to 10 repetitions, 2 to 3 times daily, holding contractions 3 to 5 seconds. Week 3 to 4, increase to 10 to 12 repetitions per set, still 2 to 3 times daily, may extend hold to 5 to 8 seconds if comfortable. Week 5 to 8, progress to 12 to 15 repetitions per set, continue 2 to 3 times daily, may hold up to 10 seconds if strength allows. Long-term maintenance, continue daily practice with 10 to 15 repetitions, 2 to 3 sets. Many men see initial improvements in 4 to 6 weeks, with continued benefits over 3 to 6 months of consistent practice. Consistency is more important than intensity for pelvic floor training. Advanced technique: sustained holds. Once basic technique is mastered, sustained holds build greater endurance. After several weeks of basic practice, try longer holds. Engage pelvic floor muscles as usual. Hold contraction for 8 to 10 seconds while breathing normally throughout. Focus on maintaining gentle consistent contraction, not maximum squeeze. Release and rest 10 to 15 seconds. Perform 5 to 8 sustained holds per session. This advanced technique builds muscular endurance, supporting better bladder control during activities or urgency situations. Progress to sustained holds only after mastering basic technique with good isolation and control. Integrating exercises into daily routine. Consistency improves when exercises are integrated into existing routines. Link pelvic floor exercises to daily activities, during morning shower or bathroom routine, while brushing teeth morning and evening, during commute or waiting in line, before bedtime as part of sleep routine. This habit stacking approach makes practice automatic and sustainable. Brief sessions throughout day are as effective as single longer session, making integration into daily life practical and achievable. Common mistakes to avoid these common errors that reduce exercise effectiveness. Holding breath during contractions: always breathe naturally throughout. Excessive abdominal, buttock, or thigh tension: focus on isolating pelvic floor muscles only. Bearing down instead of lifting up: contraction should feel like gentle lift, not pushing. Practicing during urination regularly: only use urine stop test once for identification, not as regular practice. Doing too many repetitions initially: start conservatively to avoid muscle fatigue or soreness. Expecting immediate results: improvements typically require 4 to 6 weeks of consistent practice. Inconsistent practice: daily practice is essential for results. When seek professional help, consult healthcare provider or pelvic floor physical therapist if you cannot identify or engage pelvic floor muscles correctly, experience pain during pelvic floor exercises, notice increased urinary symptoms after starting exercises, have had recent prostate surgery and need guidance, have chronic pelvic pain or discomfort, or don't see improvement after 8 to 12 weeks of consistent practice. Pelvic floor physical therapists can provide hands-on assessment, biofeedback training showing muscle activation, personalized exercise programs, and treatment for pelvic floor dysfunction. Who should avoid or modify pelvic floor exercises? Some conditions require medical consultation before beginning. Do not start pelvic floor exercises without healthcare provider clearance if you have acute urinary tract infection, recent prostate or pelvic surgery within past 3 months, chronic pelvic pain syndrome, active prostatitis or pelvic infection, or urinary catheter in place. Additionally, if you have overactive or hypertonic pelvic floor muscles, characterized by excessive tension, Kegel exercises may worsen symptoms. Pelvic floor physical therapist can assess whether muscles are weak or overly tight and recommend appropriate treatment. Realistic expectations for improvement. Pelvic floor muscle training requires patience and consistency. Weeks 1 to 4, learning correct technique and muscle identification, establishing consistent practice routine, minimal noticeable symptom changes yet. Weeks 4 to 8, beginning to notice improved bladder control, reduced urgency frequency for some, better ability to prevent leakage during coughing or sneezing. Months 3 to 6, more significant improvements in urinary control, reduced nighttime urination frequency for some, improved confidence in bladder control. Maintenance phase, continued daily practice maintains improvements, symptoms may gradually return if practice is discontinued. Research shows approximately 60 to 70% of men with stress urinary incontinence see improvement with consistent pelvic floor muscle training over 3 to 6 months. Results vary individually based on severity of symptoms, consistency of practice, and other health factors. Additional lifestyle factors supporting pelvic floor health. Pelvic floor exercises work best combined with healthy lifestyle practices. Maintain healthy body weight, as excess weight increases pelvic floor pressure. Avoid chronic constipation through adequate fiber, hydration, and regular bowel habits. Never strain during bowel movements. Practice good bladder habits including regular complete emptying and avoiding holding urine excessively long. Limit bladder irritants like caffeine, alcohol, and spicy foods if they worsen symptoms. Stay physically active with regular walking and exercise as tolerated. Manage chronic cough through appropriate treatment. These complementary practices support pelvic floor health alongside targeted muscle training. When TL expect results and maintaining gains. Most men notice initial improvements in bladder control after 4 to 6 weeks of consistent daily practice. More significant improvements typically occur after 3 to 6 months. However, pelvic floor muscle training requires ongoing maintenance. Muscles will weaken again if practice stops. Think of pelvic floor exercises like brushing teeth, an ongoing daily practice for continued health, not temporary intervention. Many men find that after initial intensive training period, they can maintain benefits with once daily practice or even every other day practice. However, completely stopping usually results in gradual return of symptoms over weeks to months. Conclusion: pelvic floor muscle exercises, or Kegels, provide evidence-based approach for improving bladder control and pelvic floor function in men after 50. Proper technique involves correctly identifying pelvic floor muscles, engaging them with gentle inward-upward lift, holding 3 to 10 seconds while breathing naturally, relaxing completely between contractions, and practicing consistently 2 to 3 times daily. Start with 8 to 10 repetitions, 2 to 3 sets daily. Progress gradually over weeks to longer holds and more repetitions. Integrate into daily routine for consistency. Avoid common mistakes like holding breath or excessive accessory muscle tension. Allow 4 to 6 weeks for initial improvements, 3 to 6 months for significant benefits. Consult pelvic floor physical therapist if unable to identify muscles correctly or not seeing improvement. Combined with healthy lifestyle practices, pelvic floor muscle training can significantly improve urinary control and quality of life for many men. Thank you for watching. For specific concerns about pelvic floor health or appropriate exercises for your situation, consult with urologist or pelvic floor physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on men's health and pelvic floor function, practical guidance prioritizing safety and effectiveness.